If you were convinced by MAGA that it is the left that wants to track your every move, you've got to think again. I told you this was coming, and it's happening. The Trump administration is launching a nationwide health tracking system, and they are partnering with the very big tech companies that MAGA has been warning us about for a long time. It's Google, Apple, Amazon, CVS, United Health. There's over 60 companies that are teaming up with the federal government to create a database of your private medical history. Diabetes, weight, medications, mental health records. It's all digitized. It's shareable. It's all opt-in, of course. And who is running it? It's Dr. Oz, now head of Medicare and Medicaid. We're going to look later at some of the video, but Trump stood at the White House and he said that we are finally making the dream of easily transportable electronic medical records a reality. So pause there for a second. Do you remember when it was the MAGA right screaming about vaccine passports? What about HIPAA? What about my medical records and privacy? Government health databases, they're going to microchip or they're going to track whether you're vaccinated. And we need to be skeptical about anything like this. Glenn Beck practically fainted when someone said we've got a contact trace during COVID. RFK Jr. said the government should never, ever, ever, under any circumstances, be collecting personal health data. And now RFK Jr. is Secretary of Health and Human Services. He's pushing wearables to monitor vitals. He's pushing this massive medical dragnet to study vaccines and autism. He wants the records, and Dr. Oz wants the records. So my question is, where are the don't tread on me people now? Where's the outrage from the government overreach people that say government shouldn't have any of our records? They are silent because it's now Trump doing the surveillance. So there's no conspiracy theory here. This is official federal policy. The Center for Medicare and Medicaid Services is going to maintain this system. And earlier this month, they agreed to give deportation officials access to the database, including addresses. And now they want to put your full medical history on top of it. Health tech startups, the weight loss app Noom is going to be able to pull your lab tests and give you AI-driven weight loss suggestions. And it's going to be based on even things that you've told your doctor, potentially. You use Apple Health, Noom gets the data. CMS will soon start recommending government-approved health apps on Medicare.gov. This is what they warned us about. Digital privacy experts are concerned. Genuine small government people are concerned. And this is really a surveillance scheme that they've dressed up as a wellness program. And maybe the most hypocritical part of it is that the very people who were warning us about government tracking have built this system and are saying, look at how awesome this is. So you've got Trump and RFK and Dr. Oz doing what they said. Fauci and Gates are going to do this. And of course, Fauci and Gates didn't do it, but they are the ones doing it. And the conspiracy theorists who were warning us about Gates are now applauding and saying, this is so awesome. It's MAHA, Make America Healthy Again. So listen, we were told to question authority. So here are some questions. When government joins forces with big tech and mines your personal health data, who do you think actually benefits? Because the government can track your private health info. They could monitor, they could profile, they could target people based on a condition or a behavior. Immigration officials already got access to the health databases, and they could lead deportation efforts potentially based on these databases, of course, with no due process. Big tech can then use the data to sell you products and ads. They can turn your health information really into a commodity. AI may be given access to this stuff and say, this isn't someone that should be getting health insurance or should be charged more or shouldn't get this job because of algorithmic discrimination based on weight and mental health or whatever the case may be. Of course, once you put this in a database, hackers can steal the information. That's always a threat. And then you could even have a future president, or maybe the current one, who uses the system against you and enables government abuse, enforcing mandates, denying services based on the health data. So if you were concerned when we were told it's Bill Gates doing it with vaccine microchips, which it wasn't, why aren't you concerned right now? So I want to hear from the MAGAs. Explain to me why this is okay, or do you have the testicular fortitude or the ovarian fortitude to say, you know what? I was against this when they told me it was Gates and Fauci. It wasn't. I have to be against it now as well. Are there any of you in my audience? Let me know. Make sure you're subscribed on YouTube, youtube.com/The David Pakman Show. You say you'll learn a new language every year, but few of us actually follow through. That's why I always recommend Babbel. It's the app that finally made language learning stick for me. This year, I've got a trip to France planned. I've already started brushing up using Babbel's 10-minute lessons. The app is built around real-life conversations, not games or gimmicks. So I'm learning exactly what I actually need to know when I land. I've even been using Babbel's speech recognition technology to improve my pronunciation. Super helpful. Babbel is designed by over 200 language experts and proven studies from places like Yale and Michigan State. There's a study that found that using Babbel just 15 hours is like a full college semester of a language. They offer 14 languages and more than 16 million people have used it. They've got a 20-day money-back guarantee, so it is risk-free to try. Here's a special limited time deal for my audience. Right now, get up to 60% off your Babbel subscription, but only for my audience at babbel.com/Pakman. Rules and restrictions may apply. The link is in the description.